Good morning and welcome to New South Wales Health's live update for Friday the 8th of October. There were 646 locally acquired cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and pleasingly we've seen 103,388 COVID tests reported to 8 p.m. last night. It is critical that we continue to see that high rate of testing as we move forward. In terms of COVID cases in hospital, we have 856 COVID cases currently admitted to hospital and 170 people in intensive care, 75 of whom require ventilation. Sadly, in relation to COVID deaths, we're reporting the death of 11 people who had COVID, 2 women and 9 men. 2 were in their 50s, 1 in their 60s, 4 in their 70s and 4 in their 80s. 5 were from southwestern Sydney, 3 were from western Sydney, 1 was from southeastern Sydney, 1 from Sydney's inner city and 1 was from Sydney's lower North Shore. 7 people were not vaccinated, 3 had received 1 dose of the COVID vaccine and 1 had received 2 doses. A man in his 80s was a resident at the Alaty Beechwood Aged Care Facility where he acquired his infection, and it's his 4th death linked to this outbreak at this facility. And New South Wales Health and I personally would like to extend my sincere condolences to their loved ones, to the families. There have been 414 COVID-related deaths in New South Wales since the 16th of June 2021 and 470 since the pandemic began. In terms of where we're seeing transmission continue, whilst it's pleasing to see that we've seen declines in southwestern Sydney and western Sydney, we still have those suburbs of concern around Greenacre, Yagoona, Panania, Lakemba, Blacktown, and in the Hunt area, Cessnock, Liverpool, and going back to southwestern Sydney, Liverpool, and western Sydney, Merrylands. I would like to also highlight that we are seeing increasing cases in the Hunter area. We've seen 97 cases reported across Hunter, New England, and they're scattered across many areas. We've had 27 cases in Lake Macquarie local government area, 23 in Cessnock, 17 in Maitland. We've had 8 cases in Tamworth, 6 in Newcastle, 6 in the Mid-Coast, 6 in Singleton, 3 in Port Stephens and 1 in Gunnedah. So it is incredibly important that people in that area continue to come forward for testing and also, importantly, get vaccinated. We are seeing that whilst case numbers in the greater metropolitan Sydney continue to decline, we are seeing increases in the regions, highlighting the importance of getting our vaccine coverage levels as high as possible in the regions, but also everyone continuing to be alert, regardless of where you are in the state, for symptoms of COVID and get tested. As at yesterday, we had achieved the 70% double dose target, and we've got a first dose of around 89% for our 16 plus population. And pleasingly, we've got around 63% of our 12 to 15-year-olds that have had their first dose. We have achieved 70% double dose vaccination, and I'd like to thank everyone in the community for protecting themselves, protecting their loved ones, and protecting the wider community. However, we have to set our sights to achieve well over 90% double dose vaccination, and I am confident that we can achieve this ambitious target. Please continue to get vaccinated and support others around you and assist them practically to get vaccinated. We are looking forward to opening up on Monday, but it is important that people, as we do it safely. Please remember that it's critical that you continue to wear your masks where they're required, continue to maintain that physical distancing, and most importantly, do not go out and about if you have COVID symptoms. Instead, get tested and isolate and wait until you've got a negative result. Thank you very much for all the hard work the community's done. It's an exciting time, but I caution us to do everything safely. And in terms of the sewage detection, I'd just like to indicate that we've had a sewage detection in Wee Waa in Hunter, New England region Quiridi and Barorina in Western New South Wales. So everyone in these areas urged to monitor for symptoms and get tested if they appear. Also, we've been having a program throughout this response to the pandemic around genome sequencing, and those investigations have identified a strain of Delta, which is different genome sequencing to the current strains circulating in Sydney. There's no indication that this new strain presents any differences regarding transmission or vaccine effectiveness or severity. There are currently 8 cases identified with this particular Delta strain, 7 people in one household and 1 additional case, and we're undertaking some investigations into the source and how the transmission occurred, and we'll update you when any information is available. So again, in conclusion, thank you very much for that great effort in achieving that 70% double dose vaccination. There's more work to be done, but please, as we move about from the 11th of October, it is critical that we still maintain those COVID-safe behaviours. Please continue to wear your mask. Please continue to maintain that physical distancing. Use your QR code check-in. But please, most importantly, do not go out and about. If you have any symptoms of COVID, instead get tested and remain isolated until you have a negative result. And once again, can I extend my appreciation to the hard work that the community has done over these very difficult times. Thank you.